Why are they dancing? Why all the smiles and the laughter? They live in one of the poorest countries in the world, yet they dance. Can you believe it's all because of an 8-foot by 8-foot piece of material with tiny holes in it and a string at the top? This is Malawi, Africa. And the reason they dance is because they've just been given something that can guarantee them and their children a healthier future: a mosquito net. Mosquito nets prevent malaria, plain and simple. So why is this important? Because malaria is one of the greatest killers of small children in the world. And in Malawi, it is the leading cause of death and illness. Malaria has been around for so long that it's easy to dismiss. But every now and then, an event takes place that reminds us of the pandemic nature of this disease. And for us, it occurred while visiting a regional medical clinic in Salima, Malawi. Came here to Salima District Hospital, and as soon as we got here, one of the nurses came out and says, "Hey, we have a child here who's crashing. Can you please come see her?" And we got in, and it was a 1.5-year-old little girl that her mother had walked over 40 miles to get here. She'd been sick since last week, and more than likely she had malaria. We got in, and it was obvious she was not doing well.
But we have to do an urgent improvement in cosmetics. That's more food.
We tried for about 30 minutes to get an IV and get her some oxygen. To be quite honest, as soon as we got the IV in and got the oxygen on her, I noticed she looked like she was about to go down and had a faint pulse, and she just stopped breathing. So we did CPR on her for 5 minutes to no avail, and she passed. It's not easy watching a little girl pass away in front of your eyes. It's not supposed to be, but this is the truth. One child under the age of 5 dies of malaria every 30 seconds, just in Africa. Did you hear that? Every 30 seconds. And that's not all. One person becomes infected with malaria every 10 seconds in Africa. It even kills over twice as many children than HIV/AIDS. Why is this important? Because when a parent gets sick from malaria, he or she can't work. With no work, it becomes more difficult for that mother or father to feed their children. Malaria affects everything from education to nutrition to unemployment rates and, of course, death. But here's the good news. All of this can go away, because not only is malaria highly preventable, it's also 100% treatable. Here's how it works. If you provide everyone in a village and surrounding villages with an insecticide-treated mosquito net, you essentially lower transmission of malaria by 90%. Global Health Innovations has seen this need firsthand on the ground, and we are dedicating ourselves to eradicating malaria one village at a time. Not only that, we're going into villages and we're educating people on how to identify malaria sooner so children can get treatment quickly and have a greater chance of survival. Along with our partner Patalia Foundation, we have already handed out over 7,000 nets in central Malawi, and we're just getting started. So here's the question: what can you do? Because a mosquito net only costs $8, there's no easier way to change a life or to save a life than to buy a mosquito net for a family in Africa. It's that simple. College students, adults, people everywhere are starting to jump on board in what we are calling the Under the Net campaign. So when you see the smiles, the dancing, you realize just how much this means. It's really exciting, and we need you to get involved. On our website, you can learn how by going to our Get Involved section. So what do you say? You can save a life, you can change a life. Just get under the net.
No more malaria.